Hi, I'm Dr. Randy Martin. I'm joined by Dr. John Puskas. John is I can say this, you're a fabulous cardiac surgeon, and John's going to talk to us about a very interesting trial called the PROACT trial. Is that right? Reduced anticoagulation for mechanical heart valve. Tell us what that trial was about.
So this trial continues to enroll in 2 of its 3 limbs, with the 3rd limb, which we reported today at ACC, is to assess the safety and efficacy of lower than usual doses of anticoagulation with this particular mechanical heart valve in the aortic position.
Okay, so it is a mechanical heart valve. It obviously has certain characteristics that would make low anticoagulation favorable.
We think so. Again, I have no relationship with the company.
I understand that. No, I understand
but
that.
the valve itself has some design features that allow it to have lower turbulence, more laminar flow, lower rates of thrombosis and thromboembolism than the predecessor bileaflet valves.
Okay.
It's made of a pure carbon rather than a carbon silicone composite and can be polished to a smoother surface.
Okay.
So it seems to be inherently less thrombogenic.
So tell me a little bit about the study and what you found.
So this study takes patients with some clinical risk factor for thromboembolism, the so-called high-risk aortic valve replacement patients, and randomizes them at 90 days postoperatively to receive either continued standard anticoagulation with a target INR of 2 to 3 with a baby aspirin, or to have a target INR of 1.5 to 2 with a baby aspirin. All the patients are provided home INR monitoring, and 90% of them are testing weekly and sending it in. We now have about 600 patient years of follow-up, average of about 1.6 patient years mean. And comparing the test and control groups, we see no difference thus far in the composite primary endpoint of major bleeds, stroke, TIA, thromboembolism, and valve thrombosis. Similarly, overall all-cause mortality is similar between the 2 groups. So it looks as if this non-inferiority hypothesis will be supported by the data in this limb of the trial.
John, is the trial going to be ongoing?
The trial is ongoing. This limb that we're discussing today has completed enrollment. We look forward to following those patients for a total of 5 years. The other 2 limbs are the mitral regurgitation, mitral valve replacement trial. Those patients are randomized to standard Coumadin or an INR of 2 to 2.5. And we have a very exciting low-risk aortic valve replacement limb of the trial, in which patients are randomized to standard warfarin, 2 to 3 INR with a baby aspirin, or just dual antiplatelet therapy with aspirin and clopidogrel, no Coumadin. That limb of the trial will complete enrollment later this summer, and we look forward to reporting interim results in a year or so.
So if you had to look in a crystal ball down the road, let's say that the results remain non-inferior or positive, do you think this will change practice?
I think it could very well change practice. I mean, the hope of having a mechanical prosthesis that won't wear out but doesn't require Coumadin in carefully selected patients.
Right.
I think that would be a real step forward for patient care.
Super. John, thanks for joining us, and thank you for joining us. For CardioSource Video News, I'm Dr. Randy Martin.